Hey everybody, this is Dr. Kevin McGovern, and I'm here with Dr. Clay Hammons, and today's podcast is about what law your child is breaking that could be destroying his arm. Think for that for a sec. So, Clay, what's going on, buddy?
Not much, man. Just recovering from the storm over here in Georgia a little bit. Luckily, we didn't get it that bad here, but I know some places are struggling right now. So, just doing that, man. Coaching a little travel ball and trying to get ready for the season.
All right, well, I'm glad you and your family are safe. So, the law, and I'm gonna share my screen here, and we actually have a female example of this, but the law that the Clay and I are talking about, we didn't invent it. It's called your scapular humeral rhythm. Okay. And that is essentially, this is my game test where I'm measuring the scapular coordination. So as she moves up here, basically the scapular humeral rhythm, as I understand it, we'll get Clay's opinion, is that for every 3 degrees, I lift my arms up in elevation. My shoulder blade needs to rotate or depress too, like kind of turning a boat. Okay, each has to turn a boat. However, we are living in a society. You can even see if we focus on her black undershirt here, you can see her traps coming up and together. And this test is a failure here as she's doing this. And I kind of close. She's got way too much upper trap involvement. And what I am seeing, I'm sure Clay's seeing the same thing, is that a lot of the teaches, the T, the W, the inverted W, the M, or whatever alphabet soup is happening, is over accentuating the upper traps, which is essentially moving opposite, or I like to say, trying to drive your car in reverse. And it's only a matter of time before it affects your shoulder, or if it doesn't affect your shoulder and you kind of move around it, the next joint down the kinetic chain is the elbow. And I really have never seen an elbow injury that doesn't also have a failure of the scapulohumeral rhythm law. What say you, Clay?
Yeah, I mean, I'm seeing it more and more, especially in my kids in travel ball that I coach right now. It's funny we're going over this topic today because I've got a 9, almost 10-year-old right now that is struggling with this because of the inverted W or M or like you said, whatever letter you want to name it. And so when we have that problem, it's almost inevitable that you're going to create some shoulder impingement. I think that's going to be your first warning sign, obviously, or at least what I see a lot. Is you're going to get that shoulder impingement. It's going to hurt when you throw, and it's because when I say shoulder impingement, if you've got your acromion here, and then you've got your glenoid coming in here. Whenever you elevate your arm, that shoulder blade is anteriorly rotated, so it's going to shut off that subacromial space, right? And it's not able to lift, and it's causing downward rotation as well. And then we're coming up and we're jamming our rotator cuff, our long head of the biceps tendon, our subacromial bursa, and it's going to get flared up and angry at you. And so seeing it a lot more and more, I think it's your first warning sign to something bigger that's going to happen way down the line, a la maybe a Steven Strasberg type situation.
Yeah, so getting some anatomy, the smallest of the rotator cuff, the supraspinatus, lies underneath that subacromial space, which, go to any cadaver lab and, if the space is bigger or taller than my pinky,
Yeah.
I'd say that's out of the ordinary. It is a small space, and it really depends on that movement and that supraspinatus, which really brings the humerus into the socket for the first 15 degrees of movement. It's the smallest muscle, and it gets obliterated when we are doing things like this. And I for the life of me, I cannot understand why people are teaching it. And it is a teach. No 7-year-old, 6-year-old, 5-year-old picks up a ball and gets into an inverted W to throw it for the first time. No chance. No way. And I don't know why it's being taught. It is an absolute danger. I think, and I know you were just on the Toe the Line podcast, you talked about long toss. I think this evolution of let's try to throw the ball 5,000 feet because somehow that is increasing arm strength, which, by the way, people, it's not, because arm strength does not come from the arm. But, there's no, I mean, you have to adjust your mechanics to throw the ball that far. And maybe that's where it's coming from. It's coming from a teach, but there's no person who understands how the glenohumeral joint works and scapulothoracic joint would ever teach one of those positions. Why? Because they'd get sued. Plain and simple.
I agree. I agree 100%. And that's what I try to establish, especially with my younger kids earlier on. We're putting out a routine now where I'm trying to get them to more engage the muscles that are going to support scapulohumeral rhythm and upward rotation of the glenoid fossa. Right. I want to train those muscles first, get them used to using those muscles, right, with maybe an exercise, and then say, okay, now we're going to bring this over into our throwing mechanics, right? I want you to set, come back so that you can elevate the arm up, right? Especially, if you're having a kid that's in this inverted W, you're so far anteriorly rotated, right? And then you're getting upper trap, or if not more, for me, levator scapulae involvement, because that's going to cause more downward rotation. And then you get in this position here.
Just leave your arm there, dude. Just try to leave your arm there for
Try to
2
leave your arm
minutes.
there for a while, but then get in this position and then try to elevate. You can't. It
No,
hurts.
it hurts. But they're doing it so fast and so quick, and then they
And
wonder
then
why.
yeah, and
People are
then
throwing
try to
4
go
innings and
throwing
are
a
out.
ball with try to go throwing a ball with high velo like that 60 times. It's not going to feel good.
I guess his position comes from some engineer, I was told, and I don't know this, but maybe it's lore, but people have shown me a Paul Nyon who realized that, relievers throw harder than starters. Yeah, because they only have to pitch an inning.
Hmm.
Hello. And somehow that came to fruition, this inverted W. And I know Mark Pryor was famous for doing it. He could never stay healthy. Steven Strasberg has limited use of his right arm, and that is a fact. He has limited use of his right arm to feed himself, people. Okay. And we're coming up with injuries that were never seen 30 years ago. Injuries that called thoracic outlet syndrome. So the nerve, artery, and vein that control your arm come out of your neck and underneath your collarbone. And people now, pitchers, are getting ribs removed. Now, whoever's removing a rib needs to spend the next 10 to 15 years in a maximum security prison. Okay. Because this problem is 100% fixable. Okay. And removing a rib is not how you fix it. Okay. Because he didn't have thoracic outlet syndrome 3 years ago. It was caused by these horrific mechanics that you're teaching. And now you're getting, pain, numbness, and tingling in these last 3 fingers. What say you?
Yeah,
This just makes me so angry, because this was like, and then you got physical therapists who are in this philosophy teaching the same thing. Like, you went to a kinesiology class, scapulohumeral rhythm was like day one. So
right.
obviously some of my colleagues failed this class too, because I see people out there teaching the same thing and then arguing about it. Like, hello, they make textbooks for a reason.
And I think it's so prevalent for for some reasons that we've kind of touched on in the past too, as far as just the medical model. And okay, yeah, you go to your doctor, they write you a script to go to the Mill PT clinic, and you're going to treat the symptoms of it, right? But we're never going to have the time, or maybe even the expertise, I should say, especially if you have a baseball pitcher with thoracic outlet syndrome, to work on the mechanics of the reason why it's happening in the first place. So correcting the mechanics, while it's not the quick fix, right? It's not taking the rib out, right? If
And
you
even
can
that
call
doesn't
that
work. Just ask
if you
Matt
can call
Harvey.
that a quick fix, but that may
Right.
not even work, anyway, because it's probably not the structure involved. Um, that's what really needs to be done, is a deep dive into analysis of how you're throwing a baseball, right?
Yep.
How can we take the pressure off of that brachial plexus, right? all those neural structures that are getting impinged when we're up here in this position,
Yep.
right? And so, for me, it's a lot of work on the upward rotators of the scapula, you know, refining, feeling that, and then incorporating that over into your throwing motion. Also, a lot of spine work as well. I mean, I'm big on the thoracic spine, and kids nowadays more and more we're seeing
Hmm.
this, right? And so if you're in this hyperkyphotic state, right, which most teenagers are now, or even preteens, we're down here on our phone, we're sitting at a desk all day, we're in this, right? This is already predisposing you for what we're talking about with shoulder impingement, right? Because the scapula
100%.
the scapula is already anteriorly rotated because it's just sitting on the rib cage. If your spine can't extend, then there's no way we can put you in a proper posterior tilt for you to upwardly rotate to where you can clear your arm. And that's gonna so you can't just treat a symptom here, a symptom there. It's multifaceted that has to be looked at by somebody that knows what the hell they're doing. To get their spine right, to get the movement of the scapula right, and then to transition that over into functional activities such as throwing a baseball. And that takes time. And a lot of
Yep.
people don't realize that. They want the quick fix. They want, hey, this and that. This is gonna take months.
And it's 2 points there. So, the medical model, these orthopods have gotten so specialized, right? You go to your general orthopedic practice, you got the shoulder guy, the knee guy, the elbow guy, you may have the spine guy. But how do you, like, I went to a sports medicine conference years ago, and thank God it was in Las Vegas because I was there about, 5 minutes, and I'm like, this is such garbage. You've got people up on stage talking about the shoulder and never mentioning that its articulation with the shoulder blade is so dependent on the muscles that are in the back, which is also so dependent on the mobility and alignment of the cervical and thoracic spine and your lat and your glute strength. Never mentioning it. Like, I mean, this is like you got pretty high-powered orthopedic doctors up there. And I'm like,
Right?
this is such garbage. Like garbage.
It's
So,
because they're just so myopic on one joint,
yep.
right? Okay, well, how do I get that joint to function better? Right? There's a
So,
lot of other joints involved in that.
yep. So parents, your shoulder, your child's shoulder is a multi-joint problem. Neck, thoracic spine, lumbar spine, pelvis, scapula, and then the shoulder and collarbone. So if you're going to an orthopod and they're just having you raise their arm up and not looking at and they don't put their hands on your spine, your neck, you are in the wrong spot. You are in the wrong spot. You need to go somewhere else very quickly. Because I would never in a million years start rehabbing a shoulder without aligning the spine first and making sure I've got good mobility there.
100%.
Because it won't get better.
That's honestly my first screen on a shoulder patient.
Has to be.
I don't even look at their shoulder without looking at their spine first, cervical and thoracic spine, and then maybe get into the lumbar spine. I mean, but there is specific direct correlation with cervical and thoracic mobility to a shoulder dysfunction.
100%.
And I find that is most of the time my first go-to treatment, and then ask them, okay, now go move your shoulder again after we've restored this extension in your spine. Usually it's extension of the thoracic spine. Okay, now go do that. Well, that feels a lot better. Yeah, because your shoulder blade can move along the rib cage a lot more efficiently.
Right. And the muscles are activated.
The muscles are activating. So
So, what I see or what parents should be looking for is, if we took the average pitcher who comes in, who is a shrugger, which is 99.9% of the pitchers I've ever seen, that includes pro, includes college, that includes adolescents. Something is awry at C6, C7. Something is awry at T2, T4, T6, meaning it's out of alignment which then means my rib now is going to be stuck, because the ribs, as you breathe, work like like on a well, like a pump handle, right? So my rib's going to be stuck on one side. And then as I go further down the chain, there's going to be something in the lumbopelvic area that is not going to be active. And that's even before I look at the range of motion of the shoulder. Because as Clay just said, once I fix or manually put those in place, the range of motion of the shoulder could change 50% with one mobilization, right?
Yeah.
So when you're talking about going in surgically and removing your first rib and reattaching the scalene muscles to something else, that's barbaric to me. Barbaric. And I can guarantee every person on that operating table does not have proper spinal alignment, does not have proper motion of the ribs, does not have proper motion of the shoulder blade. I don't even have to look at them.
I agree.
Because it's an overuse injury from poor movement, and it has to have a movement answer, not a surgical answer.
Yeah, and ask those patients too. When did you start experiencing this? Well, like the numbness and tingling, no. Like when did you start having shoulder pain? Like that's going to be, to me, that's going to be your first time. When did you, at what age did you start having shoulder impingement?
And
Yeah.
it wasn't last week.
That was probably 5 years ago. Oh, right. So, like I said, that's your warning. Shoulder impingement to me is the first warning sign of something else that's going to happen down the line, right? And if we don't fix the mechanics of the reasons why you're getting the shoulder impingement, um, then you're never going to be right.
Never. And parents, if you do end up, which most do, at the mill physical therapy, meaning it's not called the mill, meaning we've got quotations in there, and they start with band exercises. I need you to turn and run as fast as you can out that door.
Well, first, Kevin, it's going to start with the UBE, right?
Yes, we're going to do the UBE. Yes.
UBE. You're going to get on UBE or heat for 10 minutes first because we got to get that charge. And then we're going to go with the tech over to the bands.
Yeah, you're gonna run.
On that. Yeah, that's
because what first should occur.
And you're going to do that for 3 months and not be better.
Yeah. So what first should occur, at least in my clinic, would be aligning that spine, getting that thing moving.
100%.
Okay. Then do scapular stabilizations and lumbar stabilizations, focusing on lat, glute, and scapular depressor strength. So I'm going to share my screen again so you see this young lady and show you we have, and one thing we really didn't talk about, the traps. We got upper, middle, and lower. The upper traps I call a bully. Okay. If you've ever seen anyone, God forbid, has had a stroke or has had polio, which hopefully we've eradicated, you're going to see this kind of movement, right? This kind of contracture, that's kind of a fight or flight contracture. And that the body has a couple of these very low brain function. I don't mean intelligence, but I mean like kind of the safe mode on your Windows computer when something's wrong. And that is one of them is the flexion pattern of the body. The body just goes to it. Boom. This is safe. I come out of the womb like this. I die like this. This is what I look like. And you can see that my traps are connected to my ears. And that has to be broken. So the trap really, in my opinion, gets even further engaged and angry when we have a shoulder impingement because we're in pain. So I want to keep my shoulder here because it hurts. So it's really I'm just adding oil to this fire. So we have to, at least in my opinion, disengage that upper trap, which guess what? Is not a quick fix, not going to happen tomorrow, and it's going to take thousands of repetitions to happen. And pulling on a band is never going to fix that, ever. What say you?
Yeah, I mean, there are other ways to strengthen it. I think first, before you even get over to any band work, I mean, you have to make sure you're doing the bands correctly if that's the form of resistance you so choose to use. I don't think that all bands are bad.
Oh no, I don't want to say, but it's not step one.
It's not step one. Like I've got to get you, I like to get them prone on a table. Okay. Can you depress your scapula for me? Can you engage your low trap, your rhomboids? A lot of time they can't, and they still do this, right? And so it's just fine tuning that. Okay, I'm gonna physically now help you engage it. Okay, can you feel that? Yes, yes, right. And the funny thing about when patients get into that, your brain, you mentioned something simple your brain does. So your brain, when you engage the low trap, right, your brain automatically will shut the upper trap and levator off for you to do that. It's called reciprocal inhibition, right? So we want
Great
to train
point.
the muscles that are going to reciprocally inhibit the downward rotators, right? The muscles that are going to make your glenoid turn this way, right? We want that glenoid to turn upward. That just seems like a much better position to me if I'm going to elevate my arm, right? To be here rather than here. And so, many times it takes a few sessions just to work with them on how to do that, because there's been thousands of repetitions the other way. You've got to get the brain to go, hey, this is what I want you to fire first before we can then elevate the arm. And also, if you're going into the mill clinic and they're having you starting with shoulder exercises overhead,
Mm.
run. Like, that's the whole problem. You can't do that. So we've got to train it down low first, right? And then once you have pretty good control there, then we can start getting into our overhead activities. But it needs to be carefully monitored throughout the program. And yes,
1000%.
don't yeah. So if you're going into one of these places and your first step, you come in the clinic, you get on the UBE, you go over with the tech, and you start doing band raises overhead. You're good
You're
luck.
not gonna get better. You're not gonna get better.
Good luck. Yeah.
But I want to get back to what you had mentioned before. Kids, parents, the P word, PAIN, pain. That is the body's fire alarm. Okay. And I don't want to hear there's good pain and bad pain. No, no, no. Pain is a warning. Like something, there's like, yeah, it kind of worked out. Kind of my shoulder blades are sore. But when I move and I get pain, okay, that is a sign that something is wrong and needs to be corrected. And the body will always kind of do what you tell it to do, good or bad, and kind of circumvent around that. And then 2 or 3 years down the road, now we've got numbness and tingling in our fingers and pain, right? It's a warning. It should never, ever, ever be ignored. It needs to get checked out. Like
Yeah.
if you're driving down the highway and the car and your check engine light goes on, how many people in the world would ignore that? Not many.
Yeah. Probably a
Right?
few idiots out there. Yeah.
So the check engine light for the body is pain, right? We don't light up. We're not Rudolph the Red-Nosed Reindeer, but we don't light up, but we have pain, and that's the check engine light. That's something. Now, sometimes we go to the garage and it's just an air filter. Okay, good. Let's just do this one thing here or do this. But then sometimes we go and we need a new catalytic converter, we need a new transmission, or we need a computer system, whatever it is. But it all initially started with that check engine light, which is pain.
Yeah. And so let me ask you this, Kevin, because you probably see this a good bit too. You've got a young player and they're going and getting pitching instructions from a pitching coach who may have played in the major leagues, or been thinks that they're a guru in pitching, but your child has pain following that lesson. What should you do?
Yeah, so you were privy to an email that I sent you the other day about a kid who came to me as a pitcher and a catcher, went to a guru who owns a three-letter acronym facility or organization. We won't talk about it. We're not here to talk about other people. They patterned the entire camp after Shohei Ohtani, who is a two-time Tommy John and will be a three-time Tommy John recipient because they've yet to make any changes in his mechanics. And I didn't say anything. So usually what I do on exam is I prove what I do, right? You have to be able to, Like here, look, just let's depress your shoulder blades. Let's test you normal, and then let's do just 5 scapular depressions and check the strength, right? And I just proved them that after one lesson, the father wrote me an email saying, "Oh my God, I feel horrible as a dad because I think I hurt my son sending him to this camp where they taught almost exactly opposite of what you're doing. And you proved everything that you were doing. And after one session, my kid is pain-free." That's usually what I do. And that's sad to hear because that's just one kid. What about the other? I'm sure there were 150 kids at that camp, and they're all going to be injured. It's just a matter of when, because
Right.
you can't teach the inverted W. You can't teach drift off the mound so your arm's late. You just can't do it. You're going to run out. It's just,
And
it's
I
all
think
smoke and mirrors.
and I think that's the problem is, parents and kids think that, yeah, we should go to this former major league pitcher because they've done it, and they think that they're really good at pitching. But how many times is your kid going in there and getting a lesson on biomechanics and how you should be keeping your arm healthy?
And what's that pitcher's injury record? Like if you're
Right.
going to someone who's a 2-time Tommy John, what are you doing?
Yeah. I mean, the guy that I'm, thinking of right now, he can't pitch anymore. So because he's injured. So,
Right.
but I guess that's one of the things I want to get out there to parents is it's should be more about your child's development and r- decreasing their risk of injury. And a lot of these guys that have been pitched before, and maybe they're pretty good baseball coaches, but when it comes down to teaching mechanical sequencing so that your kid doesn't get injured, it's not always there with them, right?
No.
And so, I mean, you're not going to go into that pitching lesson and get what you just said, right? Or what I just said about, hey, this movement's bad for you. This is really poor scapulohumeral rhythm, or your spine is way too kyphotic. We need to get that in better alignment first. You're not going to get that. You're just going to get, okay, pitch, reach towards the mitt, you know, follow through, whatever they're going to tell you cue wise over and
Reach
over
back,
again.
throw. Yeah.
Yeah. And if you're seeing a pattern of, yeah, my kid's shoulder, always hurts after these lessons, find somebody else.
Please. Yes.
Find somebody else. And do your research and make sure that they're teaching them good mechanical principles that are going to keep them injury free.
100%. So we won't beat a dead horse on that anymore.
Yeah.
One of the things that Clay and I talked about is bringing to our audience different products, right? We see social media, we've seen different products out there and back and forth. Social media. This is horrible. This is terrible. This is this. This is that. So we're going to do our job to pick one. Maybe not every week, but definitely pick one, and then talk about it and its application because sometimes it's not the product, it's the application of it. And that might be the issue. But so this week's one we're going to talk about is the kinetic arm sleeve. We've all seen that on social media. It's you wear it on your shoulder, comes down to just above the elbow. This neoprene system that you wear over your shoulder, and you are allowed to use it on field. So I know the inventor, Jason Colleran, of it, and I've had one in the clinic. And I will say that it is like any other kind of brace, except obviously the shoulder has tremendous amount of movement. But wearing braces since I was 86 and I tore my ACL, I'm pretty familiar with numerous ACL and restrictive braces. So it definitely puts your arm in a very good movement pattern, right? It's not going to allow you to do something crazy, right? So it's not going to get you to the extremes. It's keeping you, if the extremes of movement are out here, it's keeping you in here and compressed, which we know what compression does. What I will say is it's not going to protect you if you're doing something insane, like we're throwing, 4-pound plyo balls and starting from the inverted W, you're going to blow your arm out. It's not going to do that. It should be done, in my opinion, in conjunction with sound mechanical training and a very sound arm care program, and then it will work like magic.
Yeah. Yeah, I haven't had much use. It's been something on the back of my mind that's been very intriguing. Like, I have a almost 10-year-old and almost 9-year-old, and they both pitch and play. And I've been, gosh, should I get my kid one of these? I mean, I'm trying to teach the principles that we're talking about to them so that we can prevent that. But
Yes, you
you know,
should, especially
it
the young, especially the little guys, because it'll really help with good,
right.
especially if
And
you're
so
teaching them good sound movement.
that was my thought process was like, maybe I should get them this while they're still learning it, just because their mechanics aren't perfect. They're not going to be perfect
Oh,
in
no.
a youth player that is developing, and that takes years to
And it,
get
it
those
gives the
mechanics
it gives
right.
the good player very good biofeedback, which is
And
important
so,
about
yeah,
what's good.
it's
Yep.
the biofeedback, and so I think it would. I think I'm going to look into it. For getting one for each of my boys, just because I have seen the research on it, and it does take the stress off of the shoulder and the elbow, not letting you get into extreme ranges of motions in terms of force. So, if you haven't read that research on it, I think they have a really, really good website that you can go look up, all the, the white papers and all these other case studies and things that they have. And so anything, that's what I always, when I'm looking at a product, anything that is backed by sound research that you can see
Mm-hmm.
is something worth taking a
And
chance on.
and
I
and
think
we'll
this
have
is products.
Jason Collar, and the creator, on the show. He is a walking encyclopedia of knowledge. Like sometimes he puts me to shame. So
Oh
we're
yeah.
talking about biomechanics. I'll bend the knee to him, but he's definitely been attacked, especially at the one story I have is he and I went. There are people out there who say, like, for instance, the armcare.com people who say that, shoulder strength is the end all be all, meaning that is your bulletproof for anything. Mechanics, a hurricane, if you have 5 out of 5 rotator cuff strength lying on your back up against the wall doing isometric strengthening, okay. But when we pitch, we stand and move, but that's neither here nor there. That you are going to be invincible from injury, and that's just not true. It just doesn't bear out there. As we talked about today, again, you're talking about rotator cuff strength and not talking about all of the other facets that go into movement: the scapulohumeral rhythm, the spine, the pelvis, the feet. It's never just one
Yeah.
thing. It can't be
Right. Yeah. So much more involved than just shoulder strength. That's just one facet of it,
one
right? I mean,
facet.
yeah, is it good to have your shoulder strong and be stable,
100%. Yep.
especially if you're one of those guys that has a hyperlax shoulder and you have greater than 180 degrees of range of motion? Heck yeah, I want you to stabilize your shoulder,
So,
right?
getting back to that story, the owner of the arm care started chattering at Jason and I, and we challenged him. Let's get into a room. Like,
Hmm.
I wouldn't challenge Jason on any sort of evaluation. I wouldn't be that dumb, but he was. And then that kind of, let's get into a room and we'll get 3 pictures and we'll each evaluate the pictures. You do your method, he and I will do his method, and then we'll see what you missed. And of course, that never came to fruition. We'll
Never
just
happened.
we'll just leave it like that. And dude, I would net I like I've been doing this a long time. I wouldn't go up against Jason. Wouldn't.
Awesome, man.
And
I'm looking
and
forward to
and we'll
hopefully
have
having
him on the
a talk.
podcast because he is a
Yeah,
wealth of knowledge. So
I would love to. But
definitely
yeah,
the
this
we
definitely.
yeah we I would say that I would definitely endorse the, I'm not paid here. No one, even Jason doesn't know I'm doing this. I would definitely, the kinetic arm sleeve definitely has its purpose and place, along with, just like anything, diet and exercise. We need sound mechanical training and sound arm care and sound movement techniques.
Yeah. And so would you say with that device, because you're more familiar with it than I, is that something that you're trying to train with all the time? or is that something you're
Uh,
using more just like
yeah,
in game, or do we want to train without it as well? Like, because it seems like to me it's, I mean, I don't want it to be like a band-aid, for what I'm really trying to do with that patient or even my own son.
sure.
But
I
so
think
how
it's
would you
got multi
say?
purposes. I think if your arm is sore, you would use it as a brace. But I think if we're talking about someone who's healthy and then we're doing it preventative, I would use it as a training technique. As you're coming in, we're doing this, we're developing proper sound motor patterns, and then we're going to do without. Okay, that's still good. Let's go back and do this. If you're injured, could it help, help protect your arm against further injury? Yes, but I mean, I'm trying to prevent. I guess it really comes down to what your purpose is.
Okay.
But I think it could be used for both.
Okay. Good deal.
All right, guys. So I think we've come to the end of another podcast. Hopefully, you've got some good information out this. Please like and subscribe on YouTube when you see this up there. And Clay, how can they people get a hold of you?
Yeah, you can reach out to me on Facebook, Clay Hammons, Hammons, or on Instagram at Clay Ham, ClayHamm. Feel free to DM anything that you have for me. Willing to help you out.
Awesome. And I'm at Kevin J. McGovern PT on Instagram, Twitter, and many social media platforms. So long, everybody. Thanks for listening.
Thanks, guys. Thanks, Kev.